So I started with MySpine MC to treat patients because a lot of my patients are elderly people with osteoporosis. A lot of the diagnosis that I have is spinal canal stenosis with listhesis, and in my opinion patients are doing better doing decompression and fusion. But before MySpine MC I had the difficulty to put in pedicle screws that had a firm grip, and because of the use of MySpine MC I am able to fuse those patients, and they are doing clinically a whole lot better than before. And the second advantage of the technique is that we can do it in a minimal invasive way, which has a big benefit for surgeon and patient because they have less pain postoperatively. They can move earlier, and especially in the elderly people, it is important to get them on their legs as soon as possible. The use of the cortical screw improved even more the grip of that screw. So I think now I'm treating patients 70 and 80 years old in a very good way. So I'm very pleased with the technique.